north of 60. We are filming outside today because we're still in the midst of the COVID-19 pandemic. But I have as my guest Doug McDowell from IEN Risk Management. And you might remember Doug from a previous visit in the fall where he talked about Medicare. Doug has become my Medicare go-to guy, and today we're going to talk about VA benefits and the relationship between VA benefits and Medicare. Thank you so much, Doug.
Good morning, Heidi.
Nice to have you here.
Nice to be out of the house.
Yeah, yes.
Yes.
Let's talk about, at the very beginning, do you feel that every person who served our country should at some point enroll for VA benefits? Is there an age limit? Is it hard or easy to do that?
Yes, they should. Anybody that's served in our country needs to apply, should apply. They don't need to. They ought to apply for VA benefits as soon as they think about it, as soon as they get motivated to do it. Certainly, they can do it at any time, but you don't automatically get VA benefits. You have to apply. Now, when we talk about veterans benefits and people that served, there are two basic plans that we're not going to talk about, but I mentioned just for those that have actually served their full 20 years or more in the service, or are dependents of those people who have entirely different plans that aren't what we're going to talk about when we talk about VA benefits and Medicare.
Okay.
There's a program called TRICARE, and it's TRICARE for life if you're over 65. And those are people that did the full 20 or more years, retired from active duty serving their country. It's called TRICARE initially, and then when you're 65, it matches up with Medicare and becomes TRICARE for life. What it is a Medicare supplement plan with drug benefits and a lot of benefits. If those people, if someone is 50% or if there are dependents, wife or children of a former service member who is either 50% or more disabled and or passed away during their service, they get a program called CHAMP VA, which is very, very similar to TRICARE.
Okay.
Or TRICARE for life. The vast majority, which falls into our category, is people that served 1 day or more wherever and whenever in the service. They are eligible to apply for VA benefits. Okay? VA benefits have to be applied for. They can be done online.
Is it a difficult process?
It's not a difficult process.
Oh.
Anybody that served in the military is well familiar with a DD-219. If you've been in you know what your DD-219 is. You've got copies of it. You need that plus nothing else. Go online to VA website and you can apply.
Wow.
For VA benefits.
How long does it take, Doug, for the benefits to kick in if you apply online?
First of all, it's a process where there are categories of eligibility.
Yeah. The
And
priorities, right?
There's priority lists that go 1 to 9, I believe, or 10. Priority number 1 is those that are 50% or more disabled during their service. They get free, everything's free, maximum coverage. And then after that, there's 9 sets of categories that depend upon when you served, what period of time, how you served, where you served, what you did. And there's no way of knowing nobody can tell you ahead of time what category you would fall into. So the only way to know what category you fall into is do the application online.
Oh, okay.
Okay, and that's very important because then you know.
And they assign the category to you?
Yes, they do. They have and it's you can imagine it's rather complex. I'm sure any of our listeners that are approximately my age and would have served during the Vietnam era, plus a lot of other categories like the Gulf War, fall into a Category 6, which provides certain benefits that Category 5 doesn't, and 7 and so forth.
Okay.
So you need to find out what category you're in.
Now, even if most of our viewers are Medicare
Sure.
holders, so what is the relationship between Medicare, even Medicaid, and VA?
Okay, this is in the retired person's world of health insurance. This is a unique situation where you can be covered by both. In fact, Medicare will always take precedence, but you have an option of taking a Medicare Advantage, supplemental, or drug plan to be able to choose between the two, be able to choose between Medicare plans and the VA benefits. In fact, the VA highly, highly recommends that when you're eligible for Medicare, and even if you choose to go to the VA for most of your benefits, that you do sign up for Medicare, which is Parts A and B, which means you would have to pay the Part
Right.
B premium. Some people, if they have less funds, might say, well, why would I pay that $144 for the Medicare benefit when I can go to the VA, at a
Right.
low cost?
Right.
Well, they think initially that it's free. It's not free.
So,
There is no premium for.
but services are not free.
They are not free.
Oh,
There's
I
copays.
didn't know that.
There are copays, and it depends upon the level of copays can very much depend on your financial capabilities. There's a financial test.
That's what I wanted to ask you. So is there a financial test for each of those priorities or categories?
No. Depending on what category you're in, there might or might not be a financial test. For
Okay.
example, in Category 6, if you served during the Vietnam era, and I can't remember what the years are offhand, it's from the early 60s through maybe 71, 72, you have to give them financial information, but you're not eliminated because of that financial information. Okay. And other periods might be addressed differently. So the easy answer is you should if you're eligible for Medicare, you really should take Medicare. And there's several reasons for that, but the number one concern I would have for somebody that relied solely on VA benefits get very, very complicated and fuzzy when you get into emergency room services.
How so? You mean they don't want to pay, or?
Well, they won't pay in a non-VA facility.
Oh,
Unless
you're kidding.
you have to fulfill about 8 different requirements for that. In fact, I offhand don't know of a VA run and operated emergency facility within close proximity to Hudson.
So if you have symptoms of a heart attack and you end up going to SUMA, those may not be
or the university hospitals
Yeah.
or the Cleveland Clinic right up here in Twinsburg, and you have VA but not Medicare, you could very well face being responsible for that.
And that bill could be horrendous.
It could be.
Yeah.
It could be. And then you've got what facility are they going to deliver you to after that? I mean, they might say you have to go to the Cleveland Clinic for your heart. Now, you're not in a system that's going to pay.
Oh,
So
wow.
that's really one thing. And there are Medicare Advantage plans, Medicare Advantage prescription drug plans out there that are designed specifically for veterans that are zero premium. So at no
Oh.
cost, if you're comfortable with a Medicare Advantage plan, or you could also do it with a Medicare supplement plan. So whether you have a
For
supplement,
veterans.
I, for example, have a Medicare supplement plan. I also have VA benefits. I
Okay.
can pick and choose where I want to go for which service and so forth. On my drugs, I can also do that. So there's plenty of upside, and there are some downside. There are plenty of upsides for being in both Medicare and the VA at the same time, but just being in VA alone is not recommended by the VA.
What about, so many folks, my parents included at one point or another, ended up needing rehab or a short stay it was a nursing home, but it was actually for rehab. I know folks who end up going to assisted living, and some of those things are they covered by VA? I don't even know if they're covered by Medicare, to be very honest.
Well,
but
you've got, those assisted living is not covered by any health insurance, except you can get a stipend if you're in a long-term facility. Depending on your category again, there can be a subsidy from the VA of, I've heard, as much as $1,000 a month.
oh,
And again, this could be dependent upon your financial capabilities. Under Medicare, they cover skilled nursing,
that's
rehab.
right. That's right.
Rehab. I mean, all that stuff's covered, but assisted living wouldn't be. I've known people that had limited means, and had to move in to an assisted living and applied for and got monthly stipend from the VA. Again, depending on carrier, and that's even eligible for surviving spouses of former
Wow,
veterans.
that is a
Now-
wonderful benefit to know
Now,
about.
trust me, I am not an expert in VA benefits at all. I know there are many and varied, but there is really, with a system that you have no downside in joining, there's really, that could be one of the high encouragements.
Medicare does not pay for hearing or hearing aids or glasses. I know that we have supplemental plans that will pay for our vision care and so on. Does VA cover those things?
Again, yes, depending on the category, your time of service, and so forth. I know many of my friends go to the VA for their hearing aids and their glasses, and that's basically about all they use them for. Other than what they do is the VA requires that you have a wellness exam every year, which is sort of similar to the Social Security, the Medicare wellness exam.
Yes.
But also, they will provide flu shots. They will provide, and what I tell people, and to keep you want to keep, once you're in the VA system, you want to be active, and they require that you go to a primary care physician once a year so that they stay connected to you.
Their primary care physician?
Yeah, but it doesn't have to be your primary care.
Oh,
okay.
okay.
It's a primary care physician within the VA that sort of monitors your.
Oh.
Okay. In
All
fact,
right.
I have an annual visit coming up in 1 week with the VA, and they're not having visits right now. So I'm not going to get a televisit, but I'm going to get a phone call next week at 9:00 on Tuesday, I think, from
How are you
somebody
doing?
at the VA that's going to ask me basically, how am I doing?
Yeah.
One of the things I've noticed in my dealings with the VA is the incidence of suicides amongst veterans
Oh, yeah.
is a national
Oh, it's
epidemic
terrible.
amongst
I
all.
agree.
And so one of the things they really drill down on talking to you or seeing you once a year is to ferret out if you have any inclinations towards that. So they take a proactive stance in helping the veteran, particularly in the areas of mental health,
Good.
which has become a bigger issue.
Good.
I would say, if I was a veteran, and you go through. Now I'm one that didn't apply for the Veterans Administration benefits until I was already in Medicare. So I'm preaching this not as I did, but as I should have done.
Yeah.
Okay. Because when you're working, you'll typically have employer group insurance.
That's right.
All these things
That's
are
right.
covered.
You don't even think about it.
Trust me, you don't even think, you don't have any idea what Medicare is, But later on, when you get closer to that, time of retirement, and you start thinking about benefits, you really should, and this is my message, which I'll repeat a number of times, is take the time to go onto the website and investigate what's available for you.
I think that's an excellent idea.
What I've done is I joined 2 years ago. I went over and got my flu shot. That's my reminder to go in and see them.
Oh.
Okay, and I got a flu shot. Then I wanted to get the shingles shot.
Yeah.
And
that's
I don't
very
know.
expensive.
Very expensive, and it wasn't available.
That's right.
Okay,
I signed
I
up
don't
for
know
months.
I don't know if it's. I'm assuming it's more available now.
It is now,
okay.
but back then we were on waiting list.
And this
three
is the new
pharmacies.
2-shot.
That's
one.
right.
Okay, so I went in 2 years, I guess about 18 to 24 months ago. Oh, they get it first. They
Oh.
get something like that. They will get plenty of
Oh.
doses. What I'm thinking now in this time of COVID-19, we all hope and are praying for a vaccine to become available in the next 18 to 24 months, which we hope will happen.
Yep.
Well, then there's going to be a discussion of who gets it first and available.
Yep.
You know, that's going to be
And it's going to be, I bet, hard to come by.
initially everybody's going to want to get it.
Yep.
But where's it available?
Right.
Well, I'm not sure of this, but I would think that the availability of that a shot like that would be readily available to veterans through the VA.
Oh,
so
that's a
that
good
would be
point.
if, you know, if somebody says, well, I can't have any benefits. I didn't serve in this and that. I was only a 6-month reservist. Well, you don't know. And another thing that people don't realize is that there are certain groups in certain categories that are guaranteed VA veterans benefits through the Veterans Administration. You might be in a category that means you can only get VA benefits if there's availability of, they have a limit on certain
Okay.
categories, okay? Well, the sooner you get your name on a waiting list,
Right.
the sooner you'll get in.
Right.
And once you're in, you're in.
Right.
So if you're in a category that there might not be availability today and you're 40 years old, there's nothing to hurt you by getting your VA benefits and or get on the waiting list now.
Yeah.
Because there's all kinds of benefits that you could get and not any downside.
Doug, I want to ask you two things. You mentioned meeting with a gentleman you were signing up either him or you were signing his family up for Medicare benefits and discussing the plans and so on with him. And he was, if I remember correctly, in his 80s.
Wow.
And you encouraged him to sign up for VA.
Well, he actually was 97
97, that's
and
right.
a World War II vet.
Wow.
Okay, and he had a Medicare Advantage plan, Medicare Advantage prescription drug plan, but he was going into an assisted living, and you know they have networks, and you know it was a local plan that didn't include in the network, say, the Cleveland Clinic emergency room up in Twinsburg. And he was now living in Aurora. Well, we were able to get him into a 0 premium
Wow.
Medicare Advantage plan where if anything happens, he can access the Cleveland Clinic emergency room.
Good.
Okay. And from Aurora, which would be the closest one,
Right.
where he couldn't before. And this is at no cost to him. Also, he and his people that work with him went through and saw which plan gave him a lower drug cost. And they were willing to go to 2 different places, and VA has a mail-in plan. Okay.
Oh.
So he could choose special drugs, special formularies. Other words, it gave him choice.
Yeah.
Gave him choice. There are also instances where, with the level of your copays, you might actually save money by using the copay through a Medicare Advantage prescription drug plan. For example, if this veteran needed a knee replacement or a hip replacement, the VA would be able to perform that at a certain copay. Well, typically the lead times on those with the VA can be difficult.
I've heard that.
And they don't readily do second opinions, okay? Whereas through a Medicare Advantage prescription drug plan or a supplement plan, through the supplement plan, there would be no copay, and he could choose an orthopedic specialist and get it done sooner. Or even through a Medicare Advantage prescription drug plan, he could go to a orthopedic specialist that's in the system and maybe even get it done sooner at a lower copay. But the thing is, you have the options.
You have the options,
You have the
and you
options.
have to do both to know what your options
Well,
are.
and again, VA recommends you do both. Because what I've learned about the VA, and they are a large government institution, and they can be very bureaucratic, but what I've learned is dealing with the VA and dealing with Social Security is they genuinely want to help the client. They really, no, they really want
I
to help.
agree.
They really
They
want
just
to.
get into this myriad of paperwork.
It's not that it's not without its challenges, but they at least, the VA wants you to get what's best for you. And so that's a reason why, and with Medicare Advantage, with veterans that are also below the poverty level, that might be on Medicaid, I tell you, between Medicaid, Medicare, and the VA benefits, a Medicare client truly living in this area could get unbelievable options of world-class care.
Wow.
With zero premiums and zero
Wow,
copays.
that's excellent.
In-
That's
wi-
nice
including
to know.
dental through certain MAPD plans. So, and that isn't necessarily, it could very likely be a former veteran who lives in Hudson, Ohio, who's been fortunate enough or unfortunate enough to outlive a lot of his resources and finds himself or herself due to no bad decisions and no
That's right.
and no ill on their own
That's
in a
right.
position where they could use these benefits.
Well, Doug, we're living so much longer. There are lots and lots of 90-year-olds around, and I think people didn't necessarily think that would happen, that
Right
they'd
now,
be in their 90s.
Right now, in one of the recent reports I read, there are 9 million veterans in this country over 65.
Oh, my word.
And I'm guarantee you that there are not 9 million veterans that have applied for their
I bet
benefits. And the VA is actively out there trying to tell people, sign up, sign up, sign up.
Have you had good experiences personally, not just with the visit that you're doing next week, the virtual or phone visit, but have you had good experiences with the facilities and with the way you were treated?
I personally have.
That's good to hear.
Limited usage, okay?
Yeah.
But all the people I've talked to, and I know people that have had heart surgery and have been pleased. I mean,
Wow.
there is a preconception that the service could be, and I don't mean this could be less than what you might be used to in the product.
That's what I've heard.
And I genuinely think that that's a misconception. There are instances which we heard in the news
Yeah, I know.
where there are disasters. I mean,
Especially years ago. I don't think I've heard, I know there was an enormous shakeup.
well, and then they had a big thing at Walter Reed a couple years
Yes.
ago.
Yes.
But it's such a huge system. But again, another message I try to preach all the time to people is to be proactive and involved in your own Medicare insurance management. Now, you don't have to be an expert, but you don't need. These are areas that none of us should just put on the shelf and ignore.
And yet we do.
And a lot of us do.
Unless we need it.
Unless we need
That's
it,
right.
and then it can be very frustrating to move fast.
That's right.
And my message is, when you have no pressure and you don't need it, get your DD 219, go onto the website and find out what your situation is.
Last question. I have two last questions. My second to the last question is, where are the VA facilities near Hudson?
Though there's a facility in Ravenna that I have not been to.
Okay.
Parma has a very nice facility right off 480 on the west side.
Okay.
South side of Akron has a very nice facility. I've been there. It's highly automated, highly computerized scheduling. I mean, and they have
Okay.
volunteers. They help you. There's a big VA facility right down near Severance Hall.
That's what I thought.
You know, and I don't know that's more of a hospital and so forth. But there are many, many facilities close by. We, again, not only do we have world-class healthcare in this area, we have a lot of good
Good.
VA facilities.
Good. Final takeaway in one sentence or less.
Oh, I can do it. Enroll.
Yeah,
Apply.
I thought
Apply.
that was
One
what
word,
we'd say.
apply. Do
Okay,
it and do it
good,
now.
Good.
Do it now.
Good.
Do it. There's no time limit. There's no cost. There's no obligation. There's no risk.
This
You
is-
should take advantage.
Excellent.
And if you can't get find your 219, DD 219, go to the system to find it.
To find it.
They'll get it for you.
I really think this has been an enormous public service, and I appreciate this, Doug, because I can tell you from my own family that my father was a Medicare recipient until he died, and he never applied for the VA because he said they wouldn't give him anything. It was sort of this, well, I've got Medicare. And I'm so glad to know that people should do both,
And they're encouraged to do
and they're encouraged to do
Yes.
both. Thank you
Well,
for
thank
coming.
you for having me.
This is the end of North of 60 with Doug McDowell. For any questions about how to reach him, there will be information at the very end of this show. Thank you so much for watching.